Hello, everyone, and welcome to Bioethics On Call. I'm David Lemberg, a bioethicist based in San Diego. Our special guest today is Kim Evanoski, Zelda Foster Palliative and End-of-Life Care Fellow at New York University and member of the Department of Social Work and Hartford Partnership Program in Aging Education at the College of Community and Public Affairs at the State University of New York at Binghamton. Welcome, Kim Evanoski.
Thank you very much. Nice to be here.
Kim, thank you so much. Can we start by talking about your work at New York University? What's involved in being a Zelda Foster Fellow?
There is a group of social workers who are being trained to work as social work leaders in palliative care. And there is, I think, approximately 15 of us from all around the United States. We're the second cohort who are looking at developing programs and working in many different ways to advance palliative care as a part of our healthcare system.
Kim, thank you. Is there a capstone or a final project for the fellowship?
Yes, we all are a part of the process. It's a 2-year process from 2013 to 2015, and we are to develop a capstone project. And every capstone is very, very different depending on where that person is located in their profession and who they're working with or for. And mine is based in community care. I'm looking to develop a palliative care network or an alliance that will utilize have a companionship between the university and the community at looking at palliative care tools.
Kim, thank you. Can you say a bit more about the Palliative Care Alliance? Does it involve its own system of care and its own system of entry? Is that what you're thinking?
I'm interested in having that to have its own system of care and entry. The partners would actually be made up of the partners would be the alliance, as well as the university. And I'd like to use students in advancing their education and understanding of the healthcare system and how to use palliative care as a part of their practice, especially in social work and public administration, and kind of advance the thought that maybe palliative care should be the entry part to our community of care, and then using the other pieces of acute and end of life.
Kim, thank you. So palliative care, a key component of end of life care. Advanced directives are important in both of these aspects of care. Can you talk about advanced directives, living wills?
Well, one of the things that I think is really important, at least in New York State for us, is we have some palliative care tools, our healthcare proxy, and we also have a MOLST. And that's going to be hopefully upcoming, turning into an electronic MOLST. And the MOLST is a medical orders for life-sustaining treatment, and it looks like this. I brought it today. And I think it's really important to people to visually see this because it's bright pink, and it really is helping clients and patients look at their healthcare options when they are having some very, very difficult palliative care or chronic disease times. Which many of us may in our lives, and help with thinking about their decision and making their decision and working with their physician on those decisions. But social workers have a tremendous impact on that relationship in spending time to talk about it, educate, develop relationship and trust and tools. And there's a book that we carry too that I like. It's an advanced care planning tool book that describes in detail about community-wide topics, including end of life, but it has a healthcare proxy in it that's recognized in New York State. And both of these are really recognized through our Department of Health and valuable tools that I think are important to use in our communities. And I think that many professionals in palliative care would agree.
Kim, thank you. Is that workbook available for sale, or is that proprietary?
No, this workbook comes from a group that is with CompassionAndSupport.org, and the books are free. Anybody can go in New York State, or probably you could look for a book yourself if you're in a different state. But this is really for New York State clients, and this supports the effort of palliative care in making choices about your care in advanced planning, and it's all free. Any practitioner can order the books and use it in their working with their clients in their practice or in their business.
Kim, thank you very much. I'm guessing that training is critical for care managers regarding end-of-life decision-making.
I think they're critical with end of life, but I think they're even more critical to the preventative part of the planning. I really truly believe that it's very important for clients to be thinking about this way prior in advance through healthcare proxy and through the MOLST, and thinking about those decisions with their families prior to being in a situation where it becomes stressful and trying to manage that decision at the end. So I am more encouraged for not just individuals who are on the later lifespan, but for individuals in their 40s to start thinking about it, and even college students to have a healthcare proxy. I think it's very essential that we think about how we would like our care, because our care is becoming very, very complicated. It can become very complex in its system of care, depending on the nature of an injury or some kind of life event that can be traumatic with a diagnosis.
Kim, thank you. So how, in fact, do you promulgate an understanding of the need for these types of documents in a younger population?
A healthcare proxy is very simple to have in place to find that trusted friend, family member, neighbor, and to put that in place, because what happens is that someone else that you don't even know may be making decisions, and that kind of takes your ability to have that control, and you're not empowered anymore. So I guess I encourage at all times for you to be able to make your own healthcare decisions, and the tools offer that ability to do that at all times.
So these really are empowering decisions for an individual.
I think so, and I think it's very important because of our technology and the complexity of the types of medical technologies that we use. I think it also offers an opportunities for families to be informed about what we want in our lives, and I think that's very important for our quality of life.
Yes, agreed, Kim. Thank you. So our last topic, I understand you have a conference coming up in May in your region in New York State. Can you tell us the name of your conference and the purpose?
Well, I am putting together a Care Management Summit 2014, and it's called Achieving Excellence, and we're very interested in making it a transdisciplinary conversation between all different types of care providers. And care providers meaning healthcare providers, individuals who do caregiving, both paid and unpaid, volunteer services, community people who are very interested in care. A lot of it's going to be community-based. It's basically targeted professionally for case managers and care managers throughout the region and New York State. And it's all about having conversations about what's happening, what's on people's minds, how they're feeling about care management topics such as palliative care pieces, advanced directives, conversations about working with teams and physicians and nurses and social workers and physical therapists. Care managers are a very diverse group of people from a lot of diverse educational backgrounds. And I don't know if too many times that one has an opportunity to really sit and explore some topic areas. We're going to be using the World Cafe as a way to get more of an understanding of what people are feeling out there or sensing.
Kim, thank you. So, achieving excellence, your intention is to cover a range of key topics of importance to care managers.
Exactly, and we have a whole array of panels. I have about 25 professionals set up in panels and through discussions and conversations, and I'm just looking forward to having an opportunity to hear what people have to say and what their concerns are, what their achievements are, where they think healthcare and other types of topics in community-based care and care management are going, where they want it to go, where they feel they need support in providing care. I do have a piece on professional self-care, which I think is very important, and we'll see how it goes.
Kim, thank you. What are the dates of the conference and how can people receive information?
The dates of the conference are May 22nd, which is a pre-conference half day, and May 23rd is the full day, 2014. And Binghamton University will be bringing it online registration probably mid to the end of January.
Very good.
So probably definitely the end of January. We've got our fingers crossed for everything to be made very simple online for registration.
Kim, thank you very much. Best of luck with Achieving Excellence Conference. Thank you very much for being with us today on Bioethics On Call. Our guest is Kim Evanoski, Zelda Foster Palliative and End-of-Life Care Fellow at New York University and member of the Department of Social Work at the State University of New York at Binghamton. Thank you very much.
It's been a privilege, and thank you so much.